the Grow RDH podcast. My name is Katie. I'm your host, and I am a dental hygienist from South Dakota. I like to just get on here and talk about subjects that are on my mind. So if you are new here, thank you for joining us. Welcome. And if you are a return listener, thank you for coming back. And hopefully we will be discussing some more exciting things. We are today going to be doing a follow-up episode of last week. So last week's episode was about patient pet peeves, and that was following, just some things that patients expect, patient expectations in 2024. And so I thought this was a good segue or transition into talking now from the hygienist side. And today's episode, since you clicked on it, you already know, today's episode is dental hygienist pet peeves and what we are looking for, maybe some expectations of what we need for our day to run smoothly, right? And so that is the subject of today's episode is dental hygienist patient pet peeves. I am a little personal thing here. I am so relaxed tonight. We just started Awana. So Awana started tonight. It's Wednesday night when I'm recording this. I'll post it on Friday. But we have been back in the school routine, which has been great. But then Awana started tonight. And again, it's just like 1 hour, just time to myself where I can do stuff like this and do stuff that I like to do. And it's just kind of been a nice transition into fall and into school time. And it's been really great. So that is what's happening in my life. Comment below if you are a mama or a dad and you are enjoying the school schedule again. That has been so nice. I feel like even though maybe they don't like to admit it, kids really like routine and kids like expectations and limits. And when they're out of that routine, they sort of just go crazy. But I could rant on that forever. I'm not going to, though, to save you time. So we're going to get right into it. Today's episode, dental hygienist pet peeves. And what's interesting is when I was looking for articles, I found that a lot of our pet peeves are very sort of similar to the patient pet peeves that we talked about last week. And so it's interesting. There's a lot of alignment here. And I just think it's a great opportunity for growth, and it's a great opportunity for quality assurance and setting boundaries and creating a work environment in which we can thrive. And that's what we need for balance. That's what we need to reduce burnout. That's what we need for work-life satisfaction, right? I know a lot of people talk about work-life balance, and that's important. And sometimes it's really hard to separate those things when we're humans and have feelings and emotions, and it's hard to turn those off. So we're going to talk about 4 today. So let's get into the first one. The first dental hygienist pet peeve is last minute cancellations or no-shows. And if you are a patient listening to this, just take this with open mind. If you're a dental hygienist listening to this, this is nothing new. But what really grinds our gears is when our day's thrown off, right? We just talked about kids liking expectations. We like expectations, and it's really difficult to transition, especially further we get into this dental hygiene workforce shortage, the more packed our schedules are. And it's insane how one little misstep in your schedule can really totally blow apart your day. And it's frustrating. We rely on that a lot of the times for income. Some of us work on production, and also we just need scheduling and we need consistency. There's a fly. We need scheduling, we need consistency. We likely, because of the workforce shortage, we likely have a wait list of patients. I know some offices around here do have a wait list, and we're talking like 6 to 7 to 8 months for 6-month cleanings. And so when we have that time blocked off and we have a list of 20 patients that are dying to get in there, it's really hard when we have a no call, no show or last minute cancellation, because we can't, an hour before the time, we can't just call and expect to fill the seat. So that's frustrating. Again, if you're a patient listening to this, please be considerate of our time and call ahead as far in advance as you can. And we know everybody's human. We know that this is an issue. And I'm sure that we've probably had to last minute cancel on appointments before, medical appointments, hair appointments, who knows. But just in terms of decency and in terms of etiquette, just give us a heads up as early as you can. Even you don't think it's very early, just let us know. No shows and no calls are really frustrating for us. The second pet peeve is chronic lateness. And it's interesting because one of the patient pet peeves was not getting in the chair on time or long wait times for your appointment. Referring back to what we just talked about and having packed tight schedules, we may be seeing 8 to 10 to 12 patients a day, depending on, our office flow. One patient being late, especially in the morning, can completely undo our day, right? If you're 10 minutes late and you're already pushing that time to be within an hour or 45 minutes sometimes, 10 minutes out of a 45-minute appointment is huge. That is going to push you behind consistently through that whole entire day. That's going to affect not just you and the hygienist, speaking to the patient here. You showing up late for a dental appointment not only affects the dental hygienist, but also every single patient that's behind you. And so I know patients get frustrated when we're really strict on, like, if you're 15 minutes late, we can't see you. And it's like, well, I blocked off this time, or I got time off work to come. And that's fine. But you have to realize that there are a whole list of other patients that your lateness has now impacted. And my complete day and my complete schedule now is 10 to 15 minutes behind because you were late to your appointment. So that's hard. It's hard because, again, we're all human and there's such a balance of, like, mistakes happen. Yes, we get that. Chronically, I mean, if it is happening like once or twice, that's fine. But when this becomes a chronic problem and we're consistently seeing this lateness, it's really frustrating for us as providers to get everybody seen and to get all of our duties done and make sure that that duty is quality, right? We want to provide you with really good care. We want to provide you with thorough treatment. But when we're constantly rushing and we're constantly behind, especially because patients are showing up late, that makes it really tricky to give quality care to all of our patients like we know we want to. So that is one of our biggest pet peeves. And as a patient, it is just something to just please try and be aware of and be a little more mindful of. The third pet peeve that dental hygienists report is having poor oral hygiene before your dental appointment. This is frustrating for us because we spend so much time on education. And especially if you're a patient of record and you have been coming every 6 months, more than likely we put a lot of time and thought into what we recommend, regimens and home care recommendations. And so when we're doing those and you're coming consistently, tons of plaque and tons of bleeding, it's so disheartening. It's disheartening because we want the best for you and we want to see you thrive. We want to see your mouth in good shape. It's not because it makes our jobs harder. It's because sometimes it does feel like we're shouting into a void or maybe like a black hole. We're shouting into a black hole and it's consistently not being followed up on. That is a problem that most healthcare providers do, right? Patients know what's good for them and what's not good for them. We talk a lot about this when we talk about motivational interviewing. And smoking is the best example I have. Patients know that smoking is bad for them. We know that smoking is bad. And yet there is a lot of pieces at play. There's addiction, there's anxiety, there's coping mechanisms that patients may or may not have. And so I'm getting on a tangent. What I want to say about this is that we understand maybe you were late this morning. Maybe you had a day and you didn't get to brush in the morning. And so now it's 4 o'clock and you haven't brushed all day and you've ate lunch and and all this stuff. So again, when it's a consistent problem, that's when it becomes a pet peeve. And it's really hard to, sometimes I know hygienists, comment below. There are many times, not many, I'm generalizing. If a patient comes in with thick plaque, I ask them to brush before I even start cleaning, because I want them to see and know what I'm seeing. And I want them to acknowledge that I see this and I know that this is an issue. And so a lot of the times you can turn it into a learning experience, right? Let's pull out your new toothbrush. Show me how you would get this off. So I know you can do it. Just maybe had a day or weren't able to take the time to clean your mouth before you came. But it's important to us, right? That's our job. It's so important to us. And then to see the lack of care or thought put into something that we really care about is hard. It's hard for us because we're so passionate about what we see and we want the best for you. Again, we want to be able to provide comprehensive, thorough care and education, so it turns into practices, home care that really benefit you. The last pet peeve that dental hygienists have is talking or texting or playing games on your phone. And while this may be not as big of a deal, maybe when you're getting your hair done, or I don't know, you can't even do it with your nails, really. I'm trying to think of examples where it would be okay. But in the dental office, when you're laying back in the dental chair, it's very difficult or distracting for us to pull our hands out of your mouth so you can talk or text. Again, referring back to our very packed day full of tons of appointments that we have to get through, even that 30-second, oh, I got to send this text, or I have to, make this phone call, even that 30 seconds or minute-long phone call impact how we can provide care to you. And so if you're a patient listening to this, try to be mindful of how much of a distraction that is when we're interrupting the flow of the appointment. Now, if I'm charting or doing something and you just take a quick peek, great, that's fine. That's, we're not saying no phones at all, but it's very distracting when even talking sometimes. And I know you see on TikTok or you see memes of like, we're just talking to ourselves while we're working, or we're asking you questions and you can't answer them because our hands are in your mouth, literally. And so it's kind of funny. It's also for us, like if you were to answer or if you're trying to talk to us, again, we want to hear specifics about your health and your life, and we want comprehensive care. But we also don't have a lot of time to sit there and chat with you. And while I know that is important for building patient relationships, I'm not discounting that. I'm not saying don't talk to your patients or don't talk to your hygienist. Talk to us, please. But in an efficient way, and make sure, if it becomes too much, we may have to keep our hands in your mouth a little bit longer. Anyway, things that distract us, I guess, is what I'm trying to say. So essentially, this pet peeve is focused around things that interrupt our work. And that's really hard for us to stay on track. It's hard for us to stay on schedule. And making sure that we can get everything that we need done is really important to us, so we can move on to our next patient and we can give you the care you need. So if you're a patient listening to this, again, maybe just avoid using the phone as much as you would on a hair appointment, right? We know that this is probably an hour of your time that you'll never get back, but it is really important to stay still and really be focused on allowing us to do our job and allowing us to give you the best care that we can, just because we want to do that. And I have a last little pet peeve, and this is just a public service question or request. This wasn't on the list, but I see a ton of social media content surrounding this, and I don't have a specific source to cite for this. But if you are a patient listening to this, or if you're a hygienist listening to this, if you're a hygienist, I want you to not internalize the comments that patients make to us about how much they dislike us, or by proxy, the dental office in general. There are so many times, we've all been through it. This is for hygienists, all hygienists have been told how much somebody hates coming to see them. While it may be sort of funny to you or tongue in cheek to you, or it may be a coping mechanism, like almost like when people laugh at a funeral because they're uncomfortable. It's a reaction. It's not because they think the situation's funny. It's because they're nervous and their anxiety is coming out in an inappropriate way. And I think a lot of the times that's what happens when patients tell us they hate us. Truly, I really do believe that they're not doing it because they're trying to be mean. I think they truly have anxiety and it's coming out in an inappropriate way. Don't internalize that. As hard as it is when patient after patient after patient tells you how much they dislike you, it's hard not to internalize that. If you're a patient listening to this, just know that your hygienist really values you and wants to see you and cares about you. And when you consistently tell us how much you dislike coming to see us, it can be hurtful and it can be something that we internalize as providers because we're human beings and we don't want people to hate us. We're just humans. We're just dental hygienists doing our job. So that's my little PSA. So hopefully episode gave you some thoughtful insight into both sides of the coin. Again, last week we talked about patient pet peeves. So please go listen to that episode, listen to this episode, and just give me some feedback. What do you think? Patients, what are your pet peeves? Hygienists, what are your main pet peeves? Did I miss the mark here? What are some things that consistently impact you and your work-life satisfaction? Thank you for listening, you guys. If you found this content helpful, please consider sharing with a fellow hygienist. I love to communicate with the hygiene community, and I just think it's a great way for us to share experiences. And anytime we can share an experience with somebody else that also has the same experience, it makes our experience feel more normal. And so I think it's just helpful to talk about these things because sometimes, again, we just have to vent or we just have to experience it, talk about it, move on, or find ways to make it better. So thank you again for listening, and I will catch you next Friday.